A lot of my patients want to get long-term improvements, and a lot of the fillers that we have give short-term improvements. And patients like mine here that like to have sculpted look, be defined, get little enhancements, work out a lot, they metabolize a lot of the fillers very quickly. So the fillers in the market that we have that last a little bit longer, Sculpture, which builds collagen, Bellafill, which lasts much longer, like 5 to 10 years, and Radiesse, that's a calcium-based product to help build and kind of sculpt the face, can last up to a year or a year and a half. So in this syringe here, we have Radiesse that's actually mixed with Bellafill. So inside the calcium spheres is also the Bellafill crystals to help build collagen over time. And my patients had Bellafill once or twice before, very small amounts. He's very good looking, as you can tell, but we're just doing some enhancements. So his main features is to have a little bit more defined of a cheekbone and a little bit more defined of a jawline. So what we're gonna do is have him turn to the left. You can see he's got a nice defined jawline. We're going to go right to the angle of the jaw, and we're just going to go in and we're going to use just small aliquots of our filler. Now you can do this in threads, you can do it with cannula, you can do it a bunch of different ways, but the idea is just to get a small amount in there to scaffold the area so that we can build this 90-degree angle for him. And you see now much more of that defined angle, which she really likes. And this is an alternative for people that don't want to do an implant. Hold right here with your right hand just for a sec. Now there's numbing medicine inside, so it shouldn't hurt nearly too bad. And we're going to go to the other side now. You're just going to hold there a little bit. The needles that we use, helping your arm forward a little bit, this back. Now turn to the right, and again, following that 90-degree angle, his right side's actually a little more prominent, so we're going to create a little more evenness here. Men have a tendency to want to bleed a little bit more in this area. So we just do little injections. There's numbing in there, so after a couple points, it really shouldn't hurt too bad. Great. Now I'm going to have him hold right there. Perfect. We're going to go back to the opposite side. And I constantly change the needle so that it is very minimal pain. And I like to go a little slow, give it a little time in between the injection so that the numbing can kick in. Okay, take that away. Great. I'll do a little bit more alcohol just to keep everything really clean. You can see already it's got a nice prominence there. Bite down a little bit. Nice prominence here that's built out at the angle of the mandible. Now turn straight a little bit, and we're going to focus on just the height of his cheek. Now it always looks a little bit bigger at first, then it settles in. Now with men, when you do the lateral cheek, I want to go a little more superior. Hold right there a sec. I'll go to the opposite side. Hold on. Is it too bad in pain or no?
Mm-mm.
Okay. Good. Okay, let me grab the other. And going back and forth makes it to where there's much less pain. And it stops any bleeding. Turn it this way a little bit. We follow this angle. We're going to focus right at the lateral edge of the cheekbone. Right there. Again, dancing back and forth. Any questions people are saying or no?
They're asking what treatments you've done recently.
The patient?
No, you.
Me to myself?
Yeah.
Oh, well, that's interesting. It's an interesting question. Well, recently I did a fractura and a cosmelon. That's why my skin, I think, is glowing right
Yeah.
now. Let me see. Oh, good. So we're gonna go a little bit higher.
Where else can you use this filler?
Well, this shaping procedure can be done anywhere. I don't like to do this on lips or on hands, but for defining and shaping, it's really good. Look up a little bit.
Do you always do the cheek with the jawline?
I try to balance out the facial features. So for example, if we're highlighting his jaw, it's good to get a little bit of a lift on his cheek because it gives him more enhancement. Hold right here a second. Good. And it will, over time, like I said, this filler is a little thicker, so it looks a little more prominent at first, but then it blends in and it becomes more defined. I think depending on what you're trying to do, like for example, his chin is very perfect, almost perfect already, so you don't really need to do much. His chin is already projected, but to make his jawline more pronounced, we would then need to also balance his cheek, which is what we did. Right down again. Good, relax.
Is there a filler that can be used on the jaw and the lips?
Yeah, any filler. Juvederm, Restylane, Voluma. You just can't use these bigger, more robust fillers like Radius or Bellafill because they can form lumps or bumps in those areas. So you don't want to do that.
And what do you recommend for fine lines and knees?
Fine lines on the knees?
Yes.
Well, that's a tough scenario because sometimes you got to do skin tightening procedures like Morpheus or threads, Dermage. Sometimes you have to do fillers there. Sometimes you have to do peels. There's a lot of things to do. Oh my God, so good. You're gonna love it. I can tell. So if you guys take a look up close, show him real quick before we show him. Zoom in, look at his face straight, just kind of come forward and kind of around. You can see the elevation here, the definition there. Come to the front really quick. Look straight ahead, and I want you to do this. Bite down. No, just lay how you are, and then bite. You can see the prominence now of his defined features in there. Zoom on in with yourself, and then I'll show him in the mirror. Where is this? All right. The reveal. The reveal. But again, if you already look good, the idea was to just give him an overall little bit of an enhancement, and again, bite down so you could see the angles and everything. And then the good part is with the combination of having both the Radius and the Bellafill, he's going to get an immediate lifting effect right now, but then long term he's going to get tightening and sculpting that area that's going to stay there. So this is the Bella Sculpt procedure, combining both Radius, calcium, microspheres with the PMMA to get him a really nice defined look. All right, show him again one more time, just take a look. Looks great. Let me see you from here so I can see. Yeah, it's always good to look from far away. That was awesome. All right, guys, successful results. Have a good day. Cool. All right, let's see an after photo.